If you are on Medicare right now, I need you to stop whatever you are doing and pay close attention to the next few minutes. Because in 2026, Medicare went through some of the most significant changes it has seen in decades. And while some of these changes will put real money back in your pocket, thousands of dollars in some cases, others could quietly cost you more if you are not paying attention. The problem is that most of this information is buried in government documents and insurance company notices written in language that almost nobody can actually understand. So today, we are going to cut through all of that. We are going to go through every major Medicare change that happened in 2026, explain exactly what it means for you in plain English, and tell you precisely what you need to do to make sure you are not leaving money on the table. Let us start with the change that affects more seniors than any other. Change number 1, the $2,100 drug cost cap, your financial safety net. This is the single most important Medicare change of 2026, and it is one that every senior on prescription medications needs to understand completely. Starting January 1st of this year, if you are enrolled in a Medicare Part D prescription drug plan, the maximum amount you will ever have to pay out of pocket for your covered medications in a single year is $2,100. Once you hit that number, you pay absolutely nothing for your covered drugs for the rest of the calendar year. Zero. Nothing. Regardless of how expensive your medications are. Now, to understand why this is so extraordinary, you have to understand what things looked like before. As recently as 2024, there was no cap at all on what you could spend on prescription drugs through Medicare Part D. Seniors with serious conditions like cancer, heart failure, or rare autoimmune diseases were paying $10,000, $12,000, even $15,000 a year just for their medications. People were making impossible choices: pay for food and housing, or pay for the drugs that were keeping them alive. That era is now over. The $2,100 cap means that no matter what happens this year, no matter how sick you get or how many medications you need, your out-of-pocket drug costs are protected. The cap includes your deductible, your copays, and your coinsurance. The only thing it does not include is your monthly premium. And here is the action step that matters. If you take expensive medications and you have not already hit this cap, keep your receipts and track your spending through the year. Many seniors do not realize they have hit the cap and keep paying when they do not need to. Your pharmacist can tell you exactly where you stand. Change number 2, historic drug price cuts. Is your medication on the list? For the first time in the 60-year history of Medicare, the United States government negotiated directly with pharmaceutical companies to lower the prices of specific drugs. And the results are dramatic. 10 medications had their prices slashed effective January 1st, 2026 under the Inflation Reduction Act. The average discount across all 10 drugs is 52% off their previous prices. Let me say that again. 52%. That is not a coupon. That is not a temporary rebate. These are the new permanent maximum fair prices that Medicare now pays. Here are the actual numbers, so you can check if your medication is on this list. Eliquis, one of the most commonly prescribed blood thinners for people with atrial fibrillation and blood clot prevention, dropped from $521 for a 30-day supply down to $231. That is a 56% reduction. Xarelto, another widely used blood thinner, went from $517 down to $197 for a 30-day supply. Januvia, the diabetes medication used by millions of Americans, was slashed by 79% from $527 down to just $113. Jardiance, another diabetes drug that also protects the heart and kidneys, went from $573 down to $197, a 66% reduction. Farxiga, for diabetes, heart failure, and chronic kidney disease, dropped from $556 to $178. Entresto, for heart failure, went from $628 to $295. Enbrel, for rheumatoid arthritis, went from over $7,000 down to $2,355. The other medications on the list include Imbruvica for blood cancers, Stelara for autoimmune conditions, and Fiasp and Novolog insulin. The Congressional Budget Office estimates these negotiations will save Medicare $100 billion over 10 years, and 9 million seniors who take these specific drugs will see immediate, measurable savings at the pharmacy counter. Check this list carefully. If you take any of these medications and your costs have not gone down, call your pharmacist or your Part D plan and ask them to verify verify that the negotiated price is being applied correctly to your account. Change number 3. Insulin still capped at $35 per month. This one has been in place since 2023, and it continues into 2026. But it is worth repeating because too many seniors are still overpaying for insulin without knowing they do not have to. If you are a Medicare beneficiary and you take insulin, any insulin covered under your Part D plan, you will never pay more than $35 per month for your supply. This cap applies regardless of which plan you are on, regardless of whether you have met your deductible, and regardless of the type or brand of insulin. Before this cap, insulin could cost seniors hundreds of dollars a month. People were rationing their doses, which is an incredibly dangerous practice that leads to hospitalizations and serious complications. That should not be happening to anyone on Medicare today. If you are currently paying more than $35 a month for your insulin, call your Part D plan immediately. You are overpaying and you are entitled to have that corrected. Change number 4. Free vaccines that many seniors are still not getting. Here is something that shocks a lot of people. The shingles vaccine, a 2-dose vaccine called Shingrix that was previously available through Medicare but cost many seniors over $200 out of pocket, is now completely free. Under the Inflation Reduction Act, changes that took effect in 2025 and continue in 2026, all vaccines recommended by the Advisory Committee on Immunization Practices are now covered at zero cost under Medicare Part D. This includes Shingrix for shingles, flu shots, RSV vaccine, hepatitis vaccines, Tdap for tetanus and pertussis, and more. You pay nothing, no copay, no deductible. Shingles is not just uncomfortable, it is intensely painful, and for seniors, it can lead to a complication called postherpetic neuralgia nerve pain that can last for months or even years after the shingles rash clears. The vaccine reduces your risk by more than 90%, and it is free. If you have not gotten both doses of Shingrix, call your doctor or pharmacy today. Change number 5. Part B. Premium increase. What you are now paying. Not every change in 2026 is good news, and I want to be honest with you about the ones that are costing you more. The standard Medicare Part B premium, the monthly amount deducted from your Social Security check for your outpatient and doctor's visit coverage, increased in 2026 to $202.90 per month. That is up from $185 in 2025, an increase of $17.90 per month, or about $215 over the full year. This is the third year in a row that the Part B premium increase has outpaced Social Security's cost of living adjustment, which means that for seniors relying entirely on Social Security income, each year a slightly larger portion of their check is going straight to Medicare before they see a single dollar. Additionally, the Part B annual deductible, the amount you pay each year before Medicare begins, covering its 80% share, increased to $283 in 2026, up from $240 in 2025. And if your income is above certain thresholds, you may also be paying what is called an IRMA AS surcharge on top of the standard premium, an additional $81 to $487 per month, depending on your income level. The action step here is simple. Check your Social Security statement to see exactly what is being deducted for Part B. If the number looks different from what you expected, do not assume it is correct. Mistakes happen, and you have the right to request a review. Change number 6. The Medicare Prescription Payment Plan. Spread your costs monthly. This is a change that could be tremendously helpful for seniors who take expensive medications and struggle with large upfront pharmacy costs at the beginning of the year before they have met their deductible. Starting in 2026, if you were enrolled in the Medicare Prescription Payment Plan in 2025, you have been automatically re-enrolled unless you opted out. This program allows you to spread your prescription drug costs evenly across 12 monthly payments instead of paying large lump sums at the pharmacy counter. Here is why this matters in real life. Many Part D plans have a deductible of up to $615 that you have to satisfy before your coverage kicks in. That means at the start of the year, you might walk into a pharmacy and owe hundreds of dollars in a single visit. For someone on a fixed income, that kind of expense hitting in January before any of your annual budget has had time to build up can be genuinely devastating. The Medicare Prescription Payment Plan caps your monthly payment, spreads the cost predictably, and means you never face that sudden January shock. If you are not sure whether you are enrolled, call 1-800-MEDICARE or log into your account at medicare.gov to check. Change number 7. New prior authorization pilot in 6 states. This is a change that affects you specifically if you live in one of 6 states, and it is something you need to know about before it affects your care. Beginning January 2026, Medicare launched a 6-year pilot program called the WISER model, which stands for wasteful and inappropriate service reduction. In 6 states, Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington, certain medical services and equipment that were previously covered automatically under original Medicare now require prior authorization before Medicare will pay for them. Prior authorization means your doctor has to submit paperwork to get advance approval from Medicare before you receive certain services, things like specific types of imaging, certain equipment, and some procedures. Medicare has promised that this new AI-assisted process will make decisions faster than traditional prior authorization, but it does add a step. If you live in one of these 6 states, the most important thing you can do is ask your doctor's office before every appointment whether any service you are scheduled to receive will require prior authorization in 2026. Do not wait until after the service is provided to find out it was not approved. That is how bills that should have been covered end up on your doorstep. Change number 8. Special enrollment protection for wrong plan information. This final change is one that could save you from a situation that has trapped hundreds of thousands of seniors in the wrong Medicare Advantage plan. Here is the problem. When you are choosing a Medicare Advantage plan, you typically use the Medicare Plan Finder tool at medicare.gov to check which doctors and hospitals are in-network before you enroll. But Medicare Advantage plan directories are notoriously inaccurate. Doctors who are listed as in-network are sometimes not accepting the plan. Hospitals shown as covered have sometimes dropped out of the network. And seniors who enrolled based on that inaccurate information found themselves stuck in a plan that did not cover the doctors they needed, with no way to switch until the next open enrollment period. That changes in 2026. Under a new special enrollment period, if you enrolled in a Medicare Advantage plan based on information in the Medicare Plan Finder tool, and you later discover that the directory information was inaccurate, your preferred doctor is not in network, your hospital is not covered, you now have the right to switch plans outside of the normal enrollment window. If this has happened to you, if you are in a plan that does not cover your doctors and you relied on the Medicare directory when you enrolled, call 1-800-MEDICARE and ask about your special enrollment period rights under the inaccurate provider directory rule. This is new. Most people do not know it exists right now. Let me summarize everything we covered, because there are real action steps here that could save you thousands of dollars. If you take Eliquis, Xarelto, Januvia, Jardiance, Farxiga, Entresto, Enbrel, Imbruvica, Stellara, or Insulin, verify that your pharmacist is applying the new negotiated prices to your account. If you are paying more than $35 a month for insulin, call your Part D plan immediately. You are overpaying. If you have not gotten the Shingrix shingles vaccine, call your pharmacy today. It is free, and it protects against one of the most painful conditions seniors face. If you take expensive medications and have not enrolled in the Medicare Prescription Payment Plan, log in to medicare.gov and enroll so you can spread your costs monthly. If you live in Arizona, New Jersey, Ohio, Oklahoma, Texas, or Washington, ask your doctor whether any upcoming services require prior authorization under the new WISR pilot. And if you enrolled in a Medicare Advantage plan based on the Plan Finder directory and discovered your doctors are not in network, call 1-800-MEDICARE today and ask about your special enrollment rights. Medicare is complicated, but these changes are real and they are significant, and now you know exactly what to do with them. Please share this video with every senior you know who is on Medicare, because this is exactly the kind of information that can make a real difference in someone's life, and it costs nothing but a few minutes of your time.